Hello, future RMTs. Welcome to this online discussion. And in today's video, what we're going to discuss is all about amniotic fluid. This is actually the third to the last discussion that we would have in this course. Our learning outcomes are the following: identify the functions of amniotic fluid, describe the formation and composition of amniotic fluid, and relate the laboratory results to assess abnormality in amniotic fluid. To start, what is amniotic fluid? I want you to remember that amniotic fluid is a product of a fetal metabolism. And the purpose of amniotic fluid is it provides us, or it will give us an idea, no, of or an information about the metabolical processes of the neonate inside the mother's womb. Okay, and it will also give us an idea about the development as well as the fetal maturation of the neonate inside the mother's womb. Remember that the very purpose of our amniotic fluid is to uh, know the condition of the baby inside the womb of the mother. And aside from that, amniotic fluid will also give us an assumption of what will be the possible cytological abnormalities that can be seen, no, or what you call this cytogenic cytogenetical abnormalities or cytogenetic or genetic abnormalities in the baby, no. And remember that amniotic fluid, no, is the fluid that is inside the mother's womb, and amniotic fluid is produced, okay, no, is produced by the fetal during or the baby during the gestation. Okay, so that's the purpose. No, now what are the functions of our amniotic fluid? Remember that, like what I've said, amniotic fluid, no, is inside the mother's womb where the baby is under development, no, for 9 months of development, nandun siya, together with the amniotic fluid. And take note, guys, that the baby, no, the baby will not have a damage. The baby is stable in that condition, it is because of the amniotic fluid. Remember that this amniotic fluid provides caution, no, for the fetus. The purpose of that is so that the baby, no, the baby will not experience trauma, no, the baby will be able to move, the baby will not bump, no, inside the mother's womb, okay, because amniotic fluid allows the movement of the neonate, no, allows the movement of the neonate in the mother's womb, okay, and it stabilizes the pressure as well as permits proper lung development, no? Proper lung development of the baby. Now remember, guys, that amniotic fluid is present in the amnion. Okay, so what do we mean by amnion? Gonna write. Okay, what do we mean by the word amnion? Okay, when we said amnion, that is a membranous sac that surrounds the fetus, no? That is the membranous sac, okay, that surrounds the fetus. And the amnion is metabolically active and involved in the exchange of water and chemicals between the fluid no, and fetus. In Tagalog, no, this is referred as yung inunan ng bata. Okay? Inunan ng bata. That is what amnion in Tagalog. Alright. Now, going back to my slide, okay? Remember guys that after the first trimester of the pregnancy, no, the major contributor of the amniotic fluid is no other than the fetal urine. Okay? Remember people that the amniotic fluid volume is regulated by the balance between the fetal urine and the lung fluid. However, no? However, after the first trimester of pregnancy, okay? May 36 weeks, di ba? 36 weeks ang pagbubuntis, no? During the first trimester of the pregnancy, fetal urine, okay, after the first trimester rather, fetal urine is the major contributor of the amniotic fluid. Okay? Now remember that okay, now remember guys that again the volume of our amniotic fluid comes from the fetal urine and the lung fluid. But after the first trimester of pregnancy, it is the fetal urine, no? It is the fetal urine which is now considered as the major contributor of the amniotic fluid. Now remember, no, absorption from the fetal swallowing and intramembranous flow, no, is the one, okay, that regulates the volume of our amniotic fluid. No, that's the absorption from the fetal swallowing. Now, during the third trimester of pregnancy, this is to say that the mother is already on the terminal stage, no, on the last 3 months of being a pregnant. Doon po makikita that the amniotic fluid volume is roughly 1,800 to 200 or 2,000 ml. Okay? Or okay, 800 to 1,200. Okay? In some books or in the previews, as you can see in this slide is 1,000 2,000, no, in the older edition of the Transgender it's 2,000, but in the edition that we are using is 1,200 ml. Take note guys, volume that is larger or higher than 2,000 ml is considered as a polyhydramnios. What do we mean by polyhydramnios? It means that there is an excess amount of our amniotic fluid. What is the cause of excess amount of amniotic fluid? The excess amount or increased amount of amniotic fluid is due to neural tube defects, which will be discussed and elaborated as we go along, and due to fetal swallowing of urine. Meaning to say, decreased fetal swallowing of urine, decrease of the absorption of the fetal swallowing and intramembranous flow, which resulted into increased amount of our amniotic fluid. Now, how about if the volume is lower than 800? This condition is referred as the oligohydramnios. What does it mean? It means that there is a decreased amount of amniotic fluid. Now, what is no? What is the cause? Bakit mababa ang amount or volume of our amniotic fluid? It is because of three major reasons. Number one, It can be due to fetal swallowing of urine. Increase naman ng pag-swallow ng fetal urine. Okay? Uh, and the other one is membrane leakage. Okay? Or urinary tract deformities, which is the reason why, no? Which is the reason why, okay? Nagdi-decrease ang volume ng amniotic fluid. There are some instances or cases na akala ng mother ihi yung lumalabas sa kanya, but as a matter of fact, that is already the amniotic fluid. No? Old people will say, delikado ang maigahan ng uh, how do the old people say the amniotic fluid? Ang lubigan. Bakit? Kasi aside from it gives caution to the baby, it can also give lubrication no kapag po nanganganak si mother. Okay? Now, uh, these cases might be useful to assess the overall function of the amniotic fluid. Okay? The overall metabolism rather of amniotic fluid. Now, how are we going to have a sample? Remember, if you still remember our discussion in pericardial fluid, we said that pericardial fluid is one of the most dangerous fluid to be aspirated in the body because it's near the heart, which can aspiration of pericardial fluid can damage the muscular tissue. That's also the same thing in amniocentesis. When we said amniocentesis, that is the way to collect the procedure to collect our amniotic fluid. That's amniocentesis, the method of collection. Remember that as much as 35 ml of amniotic fluid can be collected. And take note of this. I want you to take note of this. During the first trimester of pregnancy, approximately 35 ml of amniotic fluid is derived primarily from the maternal circulation. Meaning to say, yung unang 3 months of pregnancy, that is the major contributor of your amniotic fluid. But like what I've said in the last previous slides, that after the first trimester, it is now the fetal urine, no, the one responsible for this amniotic fluid. Okay? Now, take note of this. Amniocentesis may be aspirated in between second and third trimesters of pregnancy or second and third trimester of pregnancy. Usually, the first trimester of pregnancy, wala pa yan masyadong purpose. Okay? Since majority of that came from the maternal circulation. Now, since during the second up to the third trimester of pregnancy, fetal development and fetal maturation okay, fetal urine is the major contributor, then it is the time to assess our amniotic fluid. Amniocentesis during the second trimester of pregnancy is used to assess genetic defects. Again, amniocentesis during second trimester of pregnancy is used to assess genetic defects. Example of which is trisomy 21, Down syndrome. While for the third trimester of amniocentesis, it is for fetal lung maturity as well as the fetal hemolytic disease, no, or sometimes referred as the NHD, no, newborn's hemolytic disease, or the HND pala, I'm sorry, HND, hemolytic disease of the newborns. Okay, so how are we going to handle our sample? Okay, how are we going to handle our sample? Uh, Ideally, amniotic fluid is tested for these three reasons: fetal lung maturity, cytogenetical status, which includes, no, the possibility of having an abnormality, and hemolytic disease of the newborn. So how are we going to handle, or how are we going to transport specimen? If the test is for FLM, FLM stands for fetal lung maturity, okay, the sample must be placed in ice, keep refrigerated or frozen. The purpose of that is to preserve the analytes being tested for FLM, and, no, prevents the loss of phospholipids, which will be used in assessing our fetal lung maturity. Now, for cytological analysis or cytogenetical analysis or cytogenetic studies, the sample must be kept at room or body temperature. And for hemolytic disease of newborn, HDN, okay, the sample must be protected from light because of the too much exposure or too much exposure of the bilirubin, no, which is the analyte for HDN, no, will cause decrease in the amount of our bilirubin because bilirubin is a photosensitive. Okay? Now, like what I've said, there are cases that amniotic fluid is sometimes misreferred as the maternal urine. Kasi minsan, akala ng mother, it's her urine, no, her urine. But there are cases that there's a leakage which no allows the passage of the amniotic fluid. Now, there are parameters that could help us to differentiate amniotic fluid from maternal urine. There are four analytes. We have our protein, glucose, urea, and creatinine. Okay? Protein and glucose is positive in amniotic fluid. However, in urine, it's variable. It can be positive or it can be negative. No? If the mother is a if the mother experience, no, hypertension, pwedeng mataas ang protein niya or trace amounts. Or pwede din naman glucose present in the urine of the mother if the mother developed GDM or gestational diabetes mellitus. Meaning to say, protein and glucose are less reliable analytes for us to differentiate amniotic fluid from maternal urine. A more reliable analytes can be the measurement of our creatinine and urea. Okay? Remember, guys, that the levels of creatinine and urea are much more lower than the level of creatinine and urea in urine. Okay? Remember that the amount of creatinine in amniotic fluid will not exceed up to 3.5 milligrams per deciliter, but the amount of creatinine in the urine is roughly greater than 10 milligrams per deciliter. On the other hand, the amount of our urea in the amniotic fluid, no, is not greater than or will not exceed, no, as high as 30 milligrams per deciliter. And urine contains as high as 300 milligrams per deciliter of urea. Whether a baby or whether a mother, yeah, is a uh, diabetic or not, the same levels of urea and urea is seen in the maternal urine. There is also other tests that could help us to identify or differentiate maternal urine from fetal or amniotic fluid, okay? Which is the Fern test. No? Fern test is used to evaluate the rupture of the membrane, okay? Rupture of the amniotic membrane. Now take note guys that in Fern test, the vaginal fluid is spread on a glass slide and allowed to be completely dried with air. And a positive test for a Fern test will give you a fern-like crystals. Okay? A fern-like crystals or the appearance of fern-like crystals is due to the protein and sodium chloride content in a positive screen for amniotic fluid. And this is how it looks like. Okay? That is a sample, no, positive for fern test. And that sample suggests that that is your amniotic fluid. Now, what are the different shades or color of amniotic fluid and their clinical significance? Colorless is the normal color or normal appearance of amniotic fluid. A blood-streaked amniotic fluid suggests traumatic top, okay, or worse, suggests intra-amniotic hemorrhage. Yellow amniotic fluid suggests hemolytic disease of the newborn. Okay? A dark green suggests meconium. Now, what is meconium? Meconium is the first fetal excretion of what do you mean? The first uh, excretion of the stool. That is a greenish stool, meconium. At kapag ang fetus ay inabot ng pag uh, defecate inside the maternal womb, no, inside the womb of the mother, it's toxic to the baby. That's why kapag ang amniotic fluid ay greenish or dark green in color, no, the toxicity level of the baby inside the womb is high because the meconium contains toxics, no, toxins, and a dark red brown amniotic fluid suggests fetal death. Okay? Gano'n ba katagal yung pagbubuntis? 36 weeks. Okay? Kapag po nag-overdue na, that condition is prone in the defecation of the baby. No? Na nagiging dahilan kung bakit pwedeng magkameron ng toxic reactions sa bata. Okay. Now, what are the tests for hemolytic disease of the newborn? The test for hemolytic disease of the newborn is uh, an absorbent test of amniotic fluid. No, OD450 is the other name for the hemolytic disease of the newborn. No, for the bilirubin, OD450. No, the absorbance of amniotic fluid. Now, a normal amniotic fluid is increased. No, the absorbance rather. The absorbance of amniotic fluid from a normal, no, patient is increased at 365 or decreased at 550 nanometers. Okay? Increase at 450 nanometers is an indication of hemolytic disease of the newborn. Okay? Now remember guys that the test for hemolytic disease of the newborn is the oldest routinely performed laboratory test on amniotic fluid to evaluate the severity of fetal anemia. No? Bakit po nagkakaroon ng fetal anemia? Because of the hemolysis in the red cells, which causes decrease in the amount of our red cells. Okay? And fetal anemia is seen also in the incidence wherein the mother is a Rh positive or Rh negative, no? The mother is Rh negative and the baby is Rh positive, no? The fetal blood enters maternal circulation via placenta, no? And IgG antibodies rooms in the maternal circulation. Okay? Remember also that the antibodies against red cell antigens, okay, are also capable of producing the hemolytic disease of the newborn. Now, what is the medication? Immunization of Rh negative mother may not be effective or even performed in all cases. Okay? Now, the initial exposure for uh, for the foreign red cell antigens occurs during gestation. The delivery of the foreign red cell antigen occurs during the gestation, no? And the best way to do is to give ROGAM antibodies to the mother, no? ROGAM antibodies to the mother. This will be discussed to you, no? The hemolytic disease of the newborn will be discussed in your blood bank. Okay? So the results of the analysis of our amniotic fluid for the test for hemolytic disease of the newborn is plotted in Ley graph. Okay? Now, zone 1 indicates non-affected, mildly affected fetus. Zone 2 indicates moderately affected fetus, and that suggests close monitoring. Zone 3 suggests severely affected fetus, and it means intervention is required. No? Now, what are the interferences? Includes in the test for the disease of the newborn. Meconium, debris, and hemoglobin, no, affects the test for hemolytic disease of the newborn. Now, how about for the neural tube defects? As you remember in in our discussion in clinical chemistry, we said that AFP, no, alpha 1 fetoprotein, is the major protein produced by the fetal liver during the gestation. No? And in order for us to assess the neural tube defects, no, AFP or maternal AFP is used to screen that. Okay? And increase in the AFP is seen in patients with spina bifida and anencephaly. Okay? And the confirmatory test, not to assess or to know that there is a problem or neural tube defects, is no other than acetylcholinesterase. Okay, what is spina bifida and anencephaly? When we said spina bifida and anencephaly, both of this is a neural tube defect. Okay, and when we said spina bifida, this is a condition wherein the baby has a split spine. Okay, this is a birth defect where there is a incomplete closing of the backbone and membranes around the spinal cord of the baby. While when we said anencephaly, this is a condition wherein there is a absence of the major portion of the brain, the skull, and the scalp that occurs during embryonic development. Okay. The first two pictures from the left suggest our spina bifida. Actually, spina bifida is classified into three. We have the spina bifida oculata, the meningocele, and we have the myelomeningocele. The worst case of spina bifida is no other than your myelomeningocele, wherein a visible mass-like structure is seen on the lower back portion of the baby. While on the other hand, on the other pictures, no, we have their anencephaly. Okay? Abnormal development of the skull, the brain, and the skull of the baby. Those two conditions is what we call neural tube defects. And amniotic fluid, okay, amniotic fluid collected during the second, no, no, during the, yeah, no, during the third trimester of pregnancy can be used, no, to assess the neural tube defects. Okay. Next is we have the fetal lung maturity. For the fetal lung maturity, okay, this test or the test for the fetal lung maturity detects phospholipids. Okay? Remember guys that fetal lung maturity is a respiratory distress syndrome, which is most frequently complication of the early delivery. Why? Because during the third trimester of pregnancy, that is the time wherein that the fetal lung is being developed mature. No? Nandun yung maturation, nandun yung time na nagmamature, na develop ng husay ang fetal lungs. That's why early delivery, no? Delivery is a high risk, no, for a baby to develop fetal lung or respiratory distress syndrome. Okay? And take note that respiratory distress syndrome is the seventh most common cause of morbidity and mortality of prematures. Okay? And this is caused by insufficient lung surfactants production and structural immunity of the fetal lungs. Alright, we also have your lecithin and sphingomyelin or LS ratio, which is the reference method for our fetal lung maturity, for the test for our fetal lung maturity. Take note guys that lecithin is for the alveolar stability and sphingomyelin serves as the control due to the constant production. Okay? A ratio of greater than or equal to 2.0 suggests that the baby has a mature fetal lungs. Okay? So after measuring the lecithin and sphingomyelin and we divide to get the ratio, and if the ratio is greater than or equal to 2.0, it means that the baby has a mature fetal lungs. However, this test can't be done on a specimen na contaminated with blood and meconium, as this will affect the level of our lecithin and sphingomyelin. Okay. Another test for the fetal lung maturity is no other than our amniostat. Amniostat FLM or amniostat fetal lung maturity is a immunological test for phosphatidylglycol. This is much more uh, effective than the LS ratio because no, because of it is not affected by blood or meconium. On the other hand, we also have our foam stability test, okay? And this test measures the individual surface or lung surface lipid concentration. Okay? Take note on how to perform this. 0.5 ml of amniotic fluid plus 95% of ethanol. Now shake for 15 minutes, stand for 15 minutes, and observe for the presence of bubbles. No? Values greater than 47 indicates FLM. So as you can see in this illustration, we have there a bubble formation. No? And we are going to measure that. No, we are going to measure that. And if the measurement is greater than or equal, greater than 47, or greater than or equal to 47, it indicates fetal lung maturity. Okay. Aside from that, we also have our microviscosity test. Okay. This is a friction experienced by a single particle undergoing diffusion because of its interaction with the environment at the microlength scale. The presence of phospholipid decreases viscosity. Okay? And this test is measured by fluorescence polarization. Aside from that, we also have our lamellar body count. Okay? For the detection of type 2 pneumocytes. Okay? Type 2 pneumocytes are produce alveolar surfactants which are stored in the foam of lamellar bodies. Okay, as you can see in this structure. Lamellar body diameter is similar to that of platelets. Okay, can be obtained with the use of platelet channel of hematological analyzer. Now, greater than 32 microliters or 32,000 microliters of type 2 pneumocytes indicates adequate fetal lung maturity. On the other hand, we have our OD650. Okay? Increased lamellar bodies increase OD. Take note of that. Increased lamellar bodies increase OD. Okay? And increase of OD greater than 0.150 is equivalent to LS ratio of 2.0. Diba? Sabi natin, greater than or equal to 2.0 of LS ratio indicates good maturity of the lungs. So that's almost the same in this fetal lung maturity for OD650. No? Greater than 0.150 is equivalent or almost similar to LS ratio of greater than 2.0. Okay? Now, how about for the fetal age? For the fetal age, greater than or excuse me, greater than or equal to 2.0, no, amniotic fluid creatinine means that the baby is now on the 36 weeks of gestation. Please refer that this would be 9 months. No, 9 months. 36 weeks means 9 months. Ibig sabihin, ready for delivery. Okay? Now, for the fetal well-being and maturity, these are the tests, no, that can be done, okay, and the significance of each test. Okay? So, bilirubin scan, HDN, AFP, or alpha fetoprotein, INTD, neural tube defects, lecithin myelin sphingomyelin, LFM, amniostat, LFM, home stability, LFM, microviscosity, LFM, OD650, LFM, and laminar body count is LFM. That's basically our amniotic fluid. Okay? Uh, Remember, guys, that amniotic fluid is the fluid, no, the fluid, sorry, that provides caution, no, to the baby. Amniotic fluid is essential in the development of the baby, most especially for the fetal lung maturity. Amniotic fluid also is important in order for us to know, in order for us to assess the development of the baby. Okay? It can also give us an overview of the defects, genetical defects, such as the trisomy 21. During the second trimester of pregnancy, amniocentesis is performed. During the third trimester of pregnancy, the fetal lung maturity and the hemolytic disease of the newborn is detected or tested, no, for the development of the baby. In other words, amniotic fluid is not only for the development of the baby, but also will give us an idea of the condition of the baby inside the mother's womb. It will also give us uh, it will also give us immediate response on how to handle the pregnancy of the baby, of the mother rather. And it will also give us an idea, no, on what intervention should be done during the gestation and after the birth or giving birth. Even though that amniotic fluid has a wide variety of functions, remember that amniotic fluid is rarely submitted in the laboratory. However, even though that this is rarely submitted in the laboratory, it is important for us to know what is amniotic fluid. And that is my synthesis for this topic. Again, thank you and I hope you'll